Health Update with Robin Stoloff, brought to you by Atlantic Medical Imaging, serving our community since 1964.
Whether you're a high-level athlete or weekend warrior, sport injuries happen. In fact, for those ages 35 to 54, sports-related injuries have increased in recent years. Joining us now is Dr. David Levi, and he's from Atlantic Medical Imaging. Thanks for joining us.
Thanks for having me, Robin.
You are a musculoskeletal radiologist. What is that? So
a musculoskeletal radiologist is a radiologist who subspecializes in the imaging and image-guided treatment of bones, joints, and soft tissues. So for example, if a patient is sent for an MRI of the knee by an orthopedist or an internist, they want to know, does their patient have an ACL tear, a meniscal tear, or a muscle strain? It's my job to read their MRI and tell the referring doctor and the patient exactly what they have.
You have MRI. What are some of the other imaging options available?
So patients can get a CAT scan, they get an ultrasound, they get an X-ray. And if a patient comes in and the referring doctor thinks they have a broken bone, for instance, an X-ray is an excellent option. But in patients who have a suspected muscle strain or a ligament sprain, an MRI really is the gold standard because it offers us the best imaging quality for the soft tissues.
And briefly, we've all heard of MRI, but what exactly is it?
So an MRI is different from CAT scan or X-ray. It doesn't use any radiation. An MRI uses a very powerful magnet and RF pulses, and it produces images on a computer. And then we look at those images and we tell the referring doctor and the patient exactly what we see wrong.
I'm Robin Stoloff for Health Update.
Brought to you by Atlantic Medical Imaging, serving our community since 1964.